The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, comprehensive dentistry. What's new? With us, we have two dentists, father and son, Dr. Ira Schecter and Dr. Michael Shecter. Welcome to the program.
How you doing, Randy?
All right. Now, what do they call you in your practice, by the way? They call you Dr. Michael, they call him Dr. Ira. What do they say?
Whatever they want, but usually it's Ira and Michael.
Now, you've been in practice for how many years? Over 30 years?
Since graduated in 1979, I've been in private practice since 1980 because I did a one-year surgical residency program before I went into private practice.
Okay, good. Now, before we get into today's topic, comprehensive dentistry, tell us about your practice. I mean, what kind of patients are you seeing? What's the wide range?
We actually see patients of all ages. We have little kids coming in, and we have geriatric patients well into their 90s even.
So you do everything, I mean, from dental implants, I guess you do fillings, cosmetic dentistry?
I think we really attract patients that are motivated by their health. You know, people that come in and they want to have healthy mouths, healthy bodies, and they come in seeking that comprehensive care.
Now, you both have nice teeth, right? Let's take a look at, yeah, very nice teeth. Now, your son, I mean, what role does he have in the practice? And
my son has actually been I think a great source of new energy for me. He's brought
How so?
Well, he's brought some new technology to the practice. He's introduced a whole new concept of treatment planning or treatment approach with respect to more preventative care. And okay. Michael can probably explain that better, but it's a great option that we offer our patients.
All right, now, you know, we were talking off camera. You said probably the greatest compliment, I'm quoting you, about your son is that, you know, if you go away and decide to retire, they're fully confident in his ability. I mean, you hear that? They say that?
They absolutely do, and you have to understand that the type of practice I've built, it's almost an umbilical cord that
okay.
I've remained connected with my patients. I don't shy away from treating my patients after hours if they need emergency care. My patients get my cell phone number as part of their post-op.
Is that right? Your
Absolutely. It's on the post-op sheet. And if I get a call in the middle of the night and I have to go in, which doesn't happen very often, I don't think it's happened really in the last number of years because we're very careful to try and prevent those type of problems, we deal with it. And the fact that now if I go away, and I'm doing a lot of traveling, teaching, and lecturing, Michael's there full-time. So patients are introduced to a different body, but the same philosophy and the same continuity of care.
Now, Michael, did you always know you wanted to be a dentist? You saw your father. Did you work in the practice?
Well, I think it's been just a gradual progression, right? I've always been interested in dentistry, interested in health, and I've slowly developed this idea where we can take a holistic approach to dentistry.
Are you a holistic dentist, a biological dentist?
I like to use
There's a lot of names for it.
I like to use the phrase biological dentist. I think it's a dentist that takes a comprehensive approach to dentistry, but does it from a science-rooted format.
I think, Randy, the important thing is that our patients get options.
Now, both of you are really into technology. I mean, all the new stuff.
Absolutely.
Does that make a big difference?
You know, we've always been accused of being gadget guys. And I have patients who come in and they sit there and I have to get them to stop playing with the toys, as they call them, so that I can actually do the work. But I think the important thing is that we've always wanted to give our patients the best quality of care. And you can't deny that new technology, digital radiography, for example.
So all of this technology, is it for lower downtime, better results, less pain?
I think it's a combination of things.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, comprehensive dentistry and what's new in biological dentistry. With us, my first guest is Dr. Michael Shecter. Dr. Shecter, welcome to the program.
Thank you.
Now, they don't call you say Dr. Shecter.
No, I usually go by Mike or Michael.
Pretty casual guy.
Absolutely. I work with my dad in Toronto, and we really try to take a family approach to dentistry.
You and your father, for the most part, under the same roof, you do the same type of things?
I've taken a lot of what my dad does, and of course he's been such a great mentor, such a great teacher, that I've been able to incorporate a lot of his ideas and his philosophies into this comprehensive approach that we have.
So what does that mean to you, comprehensive approach to dentistry?
I think that you can almost split it up into two different areas. There's the comprehensive approach in the mouth. It's saying, let's not just tackle this one tooth that has a problem, maybe a tooth needs a crown, but taking a look at the whole mouth and identifying if there are bugs that are causing gum disease, if there are multiple cavities in the mouth, if a patient needs some implants to restore some more biting function, that type of comprehensive approach. Then there's also the comprehensive approach with seeing what else is going on in the body. For example, with gum disease, a lot of times we have these bugs in the mouth that are causing problems.
Are they actual bugs? I mean, like
Oh, they're bugs. They're these little squirmy bugs, and you could really see them. And what we have is we have this microscope. We can take a little sample of your plaque, and we can look at it together under the microscope. And
with the patient right there?
With the patient right there. Just the other day, just 2 days ago, I had a patient that came in, and he had a slightly alarming situation in his mouth where there was a little bit of a black growth on the tongue. In short, we were able to clear up the growth on the tongue using some herbals. It was really great, but we also wanted to take a look at why is this happening to him. So, of course, I sent him back to his doctor for some blood testing so we can eliminate any major systemic involvement. But we're also taking a look at some other things. What is he eating in his diet? Why is he susceptible? Maybe taking a look at the pH balance of his body.
Is this your place as a dentist?
I think that it's my place as a health professional. I think that dentists in general have been guilty in the past of only taking a look at the success of their treatment based on what's going on only in the mouth. And I think that we need to be more conscious of what's going on in the body. I always say to my patients that everything that we do in dentistry is toxic and invasive, and it's my job to minimize that toxicity and invasiveness. So we can do that in a few different ways. One, we really focus on prevention in the office. We try to keep
preventing what? Like
preventing cavities, preventing gum disease, preventing the problems that people are often so afraid to come back to see us. And I get it from people all the time. Oh, I haven't been to a dentist in 10 years. I'm so afraid to come to the dentist. Well, if you come regularly, somewhere where you're comfortable, then we're able to keep away a lot of those bigger problems that initiate that fear.
Isn't it tough, though, to get people to do things to prevent something from happening? Because we all put things off. We don't like going to the doctor, I guess, especially the dentist.
It's interesting because in Chinese medicine, you pay the doctor when you're healthy. And when you're not healthy is when the doctor does his work for free. Because it's really our job to help you maintain your health and to work towards to work on that journey of health, to learn more and educate yourself more. And I view it as my job to give information, and it's you as the patient, it's your job to make decisions.
Do you find that if you have a healthy mouth, that you're also healthy in other areas of your life?
Absolutely.
Is there a connection?
Absolutely. I think that the mouth sometimes is a sign or symptom of a greater problem, and oftentimes what we're doing in the mouth can contribute to other health factors in the body. So a great example of this is I have a patient of mine who was diagnosed with lupus, and she was very alarmed. She's a young woman. She's 32 years old. She has 3 children, and out of nowhere she got this debilitating disease. Okay. She started investigating the situation and started to understand that a potential cause of lupus is mercury and the amalgam fillings, the mercury fillings that we used to use in dentistry.
Interesting.
And she came
There's data to back that up, what you just said, that there's a connection between mercury fillings and
autoimmune diseases?
Yes.
Absolutely.
Okay.
I'm not going to sit here and tell you that having mercury fillings in your mouth is going to cause disease.
But it can only help, I guess, to take them out?
The amalgam fillings is a potential source of mercury in the body, and mercury is the most toxic non-radioactive substance known to man. It is stored very readily into the deep tissues of our body and is very difficult to eradicate. So this woman who has lupus came to see me. We took out the fillings. She went through a process of removing the metals from her body, and she has now been symptom-free of lupus for 1.5 years.